guys, my name is Emmy. I'm coming live from Home and Rehab at Claremont. Today in this video we're going to go over a little bit more about falls risk management as well as techniques and things to look out for to make sure you stay safe at home. So just to go over a little bit of background with falls, it is estimated that 1 in 4 Americans have a fall each year, and a majority of those don't report it to their physician, which is troublesome because a lot of times if we address it early on, we can help mitigate some of that further risk of falls. Falls are also, while they don't seem that big of a deal, they can actually lead to very serious consequences if there's not adequate medical attention or addressing it early on. Because falls increases your risk of a traumatic brain injury, hip fractures, and your level of independence overall. So hopefully with this video we'll kind of go over some changes that are considered abnormal as we get older so that you can address them early on to hopefully further mitigate any falls risk in the future. So some things that may change as we get older is our sense of sensation. Some people that have the chronic conditions such as diabetes may have something called peripheral neuropathy. In that case, where the sensation to our legs or to our hands and arms changes, and you may feel constant numbness and tingling or pins and needles sensation all the time. Having that can actually increase slightly your risk of falls because of the difference in sensation. The way you feel the ground underneath you and your sense of balance changes because of that, which could affect your steadiness while you're walking, while you're standing in one place, and things like that, which can further increase your risk of falls. Another condition that can affect your balance as we get older is vestibular disorders, things that affect your inner ear system, which overall affect your balance in your body. A common one is called BPPV. Having BPPV and having vestibular disorders is it's not normal part of aging. It is a common occurrence, but it's not a normal part of aging. So if you are feeling any unsteadiness, especially when you're getting in and out of bed, when you're turning your head, or changing directions, it should be addressed by your physician, your primary care physician, or your physical therapist. Neurologic conditions such as stroke, traumatic brain injury, multiple sclerosis can also affect your balance depending on how it affected you. Sometimes it causes weakness on one side of the body, changes in sensation, your balance, and your proprioception, which is the body's way of sensing where it is in the universe, can be affected, which can also further increase your risk of falls. Another risk for falls is if you take more than 5 medications for certain conditions. This is something called Polypharmacy. There's another video that I talk about decreasing your risk of falls with managing your medications. So a lot of times with Polypharmacy, if we see multiple doctors, we may have different prescriptions for certain things, and we may not realize that we're keeping kind of like a tracking list of medications, and some of those medications may either have adverse effects with each other, or you're taking inappropriate amounts of the medication so that either your blood pressure fluctuates or you feel dizzy or drowsy all the time. So it's an important part to make sure you're keeping track of your medications in a running list, making sure all your physicians and your specialists know which medications you're taking so that they can either plan accordingly to what medication they might give you or change your medication so that it is the safest, effective dose for you. Another thing to consider is orthopedic conditions as well. So if you've ever had a broken hip, if you had to do a surgery for a broken hip, or if you have osteoarthritis really bad where you're finding your ability to get in and out of a chair or in and out of bed or walking for prolonged periods of time very difficult, could also increase your risk of falls because of how uncomfortable it may be, your decreased strength potentially, that affect how you react to a fall or how much strength you have to be able to do that activity. Another risk for falls is something called incontinence. If you feel like you can't make it to the bathroom on time, or you feel like you have to rush to get to the bathroom to make it, could also be a factor that increases your risk of falls because a lot of times people, when they feel that way, they rush to go use the bathroom, or they may have an accident, which either way could potentially lead to dangerous situations where if they're rushing, they may lose their balance and fall, or if they are not able to make it and they have an accident, they may slip and fall and hurt themselves. Another important component of falls risk is checking your vision. So vision changes are normal as we get older. but they should be periodically checked by the appropriate medical personnel for new prescriptions. If you're having any changes due to your diabetes, anything like that, should be checked, as well as when you're around the house. And I also have another video coming soon on making sure your house is safe, making sure it's well-lit areas, clutter-free, and if there's any areas that don't have enough contrast, such as steps. Steps can be a little bit tricky getting up and down. Some people put contrast tape to make sure they can differentiate which steps they're going to take. And lastly, another component of falls risk is anxiety. If you have a fear of anxiety, or fear or anxiety of falling or being unsteady, things like that, that actually could increase your risk of falls. And that's something most physical therapists and physicians actually document as they further progress through your treatment plan. So some things to make sure of, to make sure you're keeping safe, as well as increasing your safety at home, is to make sure you speak up if you have any worry, any anxiety, anything like that, or any changes that you're experiencing that are affecting your feeling of unsteadiness, your walking, and things like that. Make sure to speak up to your primary care physician, your physical therapist, in order to address those issues. Remember to stay active. Keeping active, exercising, keeping up with balance exercises and things like that actually decrease your risk of falls as you're preparing your body for those changes. Making sure, again, keeping this house safe, well-lit areas, making sure if you need to, installing grab rails at the home or going up steps, changing the contrast of steps to make sure you can see them as you're going up or down. Getting your vision checked, making sure you have the correct lenses, making sure there's no any other conditions that you may have that are affecting your vision in order to keep you safe. So again, main take-home point is that falls are not a normal part of aging. Doesn't matter who tells you that. Falls happens as I get older. It may happen, but it doesn't make it normal. And physical therapy can help in increasing your strength, helping out with your balance, as well as keeping you safe at home to make sure that no further falls happen and to keep you safe in the long run. And also consider that falls are important to consider, but you should also, if you're feeling unsteady or if you feel like you're furniture cruising as you're walking around the house, meaning you're holding onto furniture or to the wall to keep balance, that also increases your risk of falls because you're already showing states of unsteadiness. So it might be a good idea to get it checked out by your physical therapist and make sure that you are keeping up with your exercises to stay safe at home. Yeah. Thank you guys for tuning in. Hopefully we'll bring out some more videos on keeping safe at home for the older adults. If you guys have any questions, or if you are feeling like you're unsteady or you need help with your balance, make sure to give us a call. We have a physical therapist on hand to evaluate you and give you a good plan to go at home. All right, thank you. Bye.